We currently have Allison Goble in the pool, and she is going to be demonstrating some of the exercises that she had performed in her rehabilitation protocol during her recovery after her hyperextension knee injury. Again, the mechanism of injury, the hyperextension of the knee injury, caused some severe tibial bone plateau bruising that was positive on an MRI as well as the scans, and at that time the prognosis was approximately a 3 to 4 month recovery due to pain and inflammation and her limited knee extension. Obviously the first thing that we were working on with the physician's approval and the plan of care was to try and recreate normal gait patterns, and we were able to demonstrate that on the HydroWorx pool with the underwater treadmill with the resistance jets turned on, approximately 25%. With walking, she was able to recreate the true heel-toe gait pattern, which helped to encourage her rehabilitation of the knee and encourage the proper nutrition to the joint, which led her to less pain. We were dealing with both swelling, range of motion limitations, as well as strength, and we were helping to progress her as quickly as possible to return safely to sport. Allison's left knee was the side of the injury, and at first she was very limited with knee extension and had a lot of pain and inhibition with doing a normal heel-toe gait pattern. With the use of the side camera, we were able to demonstrate and recreate a normal gait pattern with good knee extension to help improve the nutrition of the joint. As we progressed her protocol, one of the biggest concerns was weight bearing through the joint and directly affecting the pain and inflammation of her knee. We were able to allow her to progress into a jogging pattern and into full running mechanics by unloading her joints and putting her into the water at approximately shoulder depth, which we were recreating at about 80% non-weight bearing. In her gait mechanics, we were encouraging her to keep a high knee gait pattern, bringing that knee through the water as if she was running on land. We were able to make sure that her gait mechanics were not being altered so that we were avoiding any type of compensation through the hip, through the knee or the ankle or the foot, which after approximately 2 to 3 times in the pool over the course of the first 2 to 3 days post-injury, we were able to get Allison back up to a normal gait pattern at approximately 3 to 4 miles an hour on the treadmill at approximately 50% resistance of the jets. Once the MRI was able to demonstrate and confirm that there was no ligament or meniscal injury, we were able to progress Allison as tolerated with other both proprioceptive and balance activities, including side running and retro treadmill, walking backwards on the treadmill against the current. If you go ahead and turn backwards now and recreate that. At this point, retro treadmill on the HydroWorx pool was allowing us to get a very consistent hyperextension of the knee that would otherwise be very painful in a normal setting. The benefit of this exercise is that Allison is recreating terminal knee extension. Again, approximately 1 to 2 days post-injury on land. She was very inhibited in this direction. Without the weight bearing and in the warm water of the pool, she was able to regain full knee extension in a closed chain pattern. And then come all the way back down. And then back all the way up. And back down. At the time of the injury, Allison was presenting on her left side with a very significant bent knee gait pattern, was really inhibiting knee extension. So as we were able to get her into the pool, she was able to reverse that inhibition and encourage the knee joint mechanics to get full knee extension early in the rehabilitation process in order to encourage the quadriceps re-education and minimize the atrophy in the VMO. At approximately 1 week post-injury, we had identified and communicated back to the physician after Allison's 1 week follow-up with her physician that she had been progressing very well, and by continuing to progress with her weight-bearing tolerance and her functional progression with running in the water, she was able to progress onto some more traditional land exercise, as well as supplementing her training in the HydroWorx pool. We would do approximately 45 minutes in the pool, progressing from typical hip and knee strengthening exercises, as well as functional training and conditioning in the water for her full return to soccer.